Hello everyone, my name is Miriam. I'll be talking about culture in the healthcare professional practice. So we take a look at the overview of the presentation. We'll have the background of the study, workplace culture definition, statistics, creating a culturally safe workplace in the renal ward. We'll talk about holistic care, cultural safe communication, patient engagement, culturally appropriate services, and we'll have a conclusion. So, who are the Aboriginal and Torres Strait Islander people? The Aboriginal people are the original custodians of Australia. They have diverse cultural languages, histories, customs, and values. There is need to involve indigenous people in a culturally appropriate and safe workplace. So we'll have a look at the next slide. We'll have a look at the definition. So on this slide, we talk about definitions of workplace culture. These are the structures, systems put in place by the organization. From the mission, goals, and objectives of the healthcare setting, it outlines the expected behaviors in the workplace. It has an impact on day-to-day activities. Cultural awareness is the ability of the staff to demonstrate knowledge and understanding of the relevant cultural issues and practices. This is done through cultural awareness training as a new employee. The Australian Institute of Health and Welfare 2022 has three important components of cultural safety, which are cultural respectful healthcare services, indigenous experience of healthcare services, our interaction with the patients, and thirdly, access to healthcare services, e.g., access to hemodialysis sessions at the right time, at the right place. So on this slide, we look at the death by indigenous status in 2023. So in Australia, 96.8% indigenous people suffered more deaths than non-indigenous people, which accounted to 2.7%. The median age of death in Australia was 79.7 years for males and 85.0 years for females. In the Northern Territory, median age of death is the lowest in Australia, accounting 67.2 years for males and 68.4 years for females. 1 in 5 First Nations people have signs of chronic kidney disease, that is double the rate of the rest of the Australian population. The incidence of kidney failure is higher in remote areas of Australia among the indigenous compared to non-indigenous Australians. Factors contributing to health status differences are access to culturally appropriate healthcare services, connection of country and language. This means when people get sick in the remote communities, they have to be moved to the city to access hemodialysis services. This is a barrier for indigenous people. And also the need for a healthcare system that respects Aboriginal culture. So we go on to talk about holistic person-centered approach. We talk about the emotional, cultural, social, and physical aspect of the indigenous people. The physical aspect pertains to the condition, the causes, the treatment options, the viewpoint of Western medicine, women and men business. Indigenous people do not believe in Western medicine. They believe in their own traditional ways of treatment. So we have to consider that in a culturally appropriate way. We have to consider emotional, their mental state. Are they depressed? Do they have anxiety? And we try to calm them down so that we are at the same level. Their cultural beliefs, values, we encompass that in our treatment. We make them feel comfortable, even if they are out of their country or communities. We try to involve those traditions that they've been doing, those traditional practices that they've been doing in their country. We also involve translator services so that one of their Aboriginal people is a representative. In social aspect, the family, friends, neighbors support and group support, travel accommodation, being away from the country, we try to involve the family and friends and the neighbors. This has an impact on the individual. For culture to remain strong, there is need for holistic care. For effective and efficient healthcare services, it has to be underpinned by a culturally safe, holistic approach to care. To look after the whole person, not just the kidney or the heart. We have to understand the person as a whole. Remote indigenous people are more likely to suffer from chronic kidney disease. Because of this, the people are forced to move from remote areas to the city for hemodialysis treatment. So we have to consider all these aspects. This is a disadvantage to them because it breaks families and they are isolated. So all these things we need to be inclusive of indigenous people. As healthcare professionals, we should be culturally safe in our communication. Healthcare professionals should be culturally competent when communicating with indigenous people. Using appropriate terms, they need to be aware of many factors which may impact cultural safety for indigenous people, such as communication styles, listening to the concerns of fears beyond the clinical conditions, as indigenous people have different approaches to managing illness. They react differently to hospital environment and different traditional approach to managing their medical conditions. Promoting culturally safe conversations about dying and being comfortable, having the right support when people are dying. To encourage cultural interactions, therapeutic communication between patient and healthcare providers is important. The healthcare professional need to explain medical terms and procedures. This is an important way to improve patient knowledge and understanding. Allowing to make informed decisions about their healthcare. Allow feedback and time to make sense of the information presented. This is an opportunity for them to repeat or explain in their own words and understanding. Patient active involvement in clear, simple, concise verbal and written instruction has enhanced therapeutic outcomes. Patient engagement with multidisciplinary team involves building trust and connections with the indigenous community. This is done through cultural activities, learning of knowledge, and sharing of stories for renal staff and patients. It gives all an opportunity to engage and build trust together outside of the hospital setting. It also creates friendships and trust between healthcare professionals and patients. Furthermore, it allows people with lived experiences to share their stories with people living with a chronic condition. Patients feel supported and cared for by the people they can confide in and trust. In the healthcare system, we have Aboriginal liaison officer role. They contribute to delivery of culturally appropriate healthcare services for Aboriginal and Torres Strait Islander patients. This role works closely with the indigenous men while also assisting and supporting female patients in collaboration with the renal ward social workers. They also work closely with the physiotherapists, occupational therapists, doctors, nurses, and other government agencies. The Aboriginal liaison officer helps provide culturally appropriate support services. These include help with the counseling, family meetings, help with Centrelink forms, banking, complaints, and they create a safe place for Aboriginal patients in the hospital. They also provide guidance for other healthcare providers on culturally safe practices. For example, you do not say someone is dying in the Aboriginal terms. You say someone is finishing up or someone is passing on. For culturally safe services, we have Aboriginal interpreter services. They provide accurate and unbiased translation between Aboriginal patients and healthcare professionals. They help lessen the language barrier faced by Aboriginal people in relation to health and legal issues. They do not provide ongoing care and support for patients. They are not only for patients but for healthcare professionals to communicate and educate patients. Interpreters help by providing Aboriginal clients with understanding of medical terminology in their own languages. In conclusion, a workplace culture which prioritizes its patients' values ensures better clinical outcomes. In order to close the gap between health statuses of Indigenous people and non Indigenous Australians, it is crucial to practice in a culturally appropriate and safe culture. A culturally safe workplace ensures a good hospital experience. Patient engagement ensures strong connections between healthcare staff and patients. Thank you.